The University of the Free State is situated in Bloemfontein, in the heart of the Free State province in central South Africa. In collaboration with several external stakeholders, the Faculty of Health Sciences at this university has developed and is implementing a community-based education program named Kopanang fodise, meaning Unite to Heal. Our goal with the Unite to Heal program is to develop a community-based centered platform where different role players can work together to promote sustainable, holistic healthcare and social development. Through community-based education centered in and around the town of Tromsburg, students are taken on a weekly rotation basis out of the classroom and into the community.
The vision of the community initiative at Tromsburg is very important for the Faculty of Health Sciences. This is part of our vision and the requirements of the professional boards to have our students exposed to the community, but also to have a primary healthcare approach. It's important for us as faculty to have our students being involved in their training in the community. This initiative will be used as a blueprint also for the faculty for other sites. It also links up very nicely with our motto, Unite to Heal, within the Faculty of Health Sciences.
Using interprofessional education, students from the different schools learn from, with, and about each other to improve healthcare. Participating in simulated activities also helped students from different schools to develop shared values, leadership, and decision-making. We now invite you to join us on one of our recent visits to Tromsburg and share in our experience of transformative learning. To prepare us for transformative learning in a rural environment, we first attended an interprofessional orientation session on campus. Thereafter, we were shuttled to Tromsburg, which is situated about 120 kilometers south of Bloemfontein. En route, a sense of excitement prevailed amongst us in anticipation of our first encounter with transformative learning and interprofessional education, during which we will learn from, with, and about each other to improve healthcare in the communities of both Tromsburg and Springfontein, which is situated a further 30 kilometers to the south. These two small agricultural towns are both characterized by poor socioeconomic conditions and high unemployment. Primary healthcare challenges are also being experienced. Nonetheless, a warm community welcomed us. The faculty bought an old hotel in Tromsburg and transformed the premises to provide for community-based and interprofessional learning. Here, more than 300 students per year settle and spend at least a week while participating in the Unite to Heal program. We were pleasantly surprised by the facilities at our mini campus, including comfortable accommodation, lecture rooms, a library, and the use of internet via Wi-Fi. What began at the beginning of the week with the sharing of an apartment with 5 strangers quickly grew into the forming of new friendships and mutually beneficial interprofessional relationships. Before experiencing community-based education and collaborative practice in action, we attended a platform orientation session with the facilitators involved. During this session, we were supplied with all the necessary information to prepare us for different interactions with the community members in the 2 rural towns. A comprehensive screening booklet to assess the health and well-being of especially school learners and diabetic patients was likewise provided. Our set weekly schedule included the following team activities and community interactions in Tromsburg and Springfontein. We did comprehensive health screening of learners at local high schools. The interprofessional approach followed in the program helped us to identify factors which could pose a risk to the well-being of these learners. Although learners were shy and reserved, we really tried our best to relate positively on a one-to-one basis with them.
Hulle sien net hier vir hulle self nie, hulle sien mense te kom help. Hulle benefit nie vir hulle nie, hulle is eintlik hier om mense te kom ondersteun waar dit nodig is.
At the clinics in the two towns, we continued with health screening. We also presented health promotion sessions for the community members with chronic conditions, such as diabetes. These community members participated enthusiastically and appreciated the information that we shared with them. However, they also taught us a lot. During home visits, we did follow-up screening and healthcare management of chronic patients identified by preceding interprofessional groups. This ensures continuity in implementing the Unite to Heal program on a rotation basis. Here, we humbly learned the importance of creating a trusting relationship between a vulnerable patient and an intrusive health worker. Not once did we feel unwelcome in their homes. In general, we found that the local residents are positive about our involvement, and some would even appreciate greater engagement in future.
Die impak wat die studente op Tromsburg het is baie positief. Hulle gesindheid is mooi. Wat hulle kennis betref, ons sal graag sien dat hulle as die arbeids- en die fisio's meer betrokke raak by die ouer tuis, want ons het hulle baie nodig.
Die studente wat hier in Tromsburg sit, hulle het ons baie behandeling, mooi behandeling. Hulle het my baie dinge geleer wat ek nie geken het nie, terwyl ek is diabetes. Van die studente vir ons treatment gegee het, is baie beter. Die seker is baie beter.
Furthermore, we took part in a community youth leadership project to involve the youth in acknowledging and addressing health and social concerns in their communities. During our stay, we developed community awareness in the form of a photography exhibition. Documenting health and social concerns by means of photography was a first-time experience for many of these youngsters, and their eagerness to partake in the project was heartwarming.
The learners themselves are very positive about the program. They enjoy it very much, and there's a lot for them to learn because they are learning real life facts in the program, and there's things that they never have been exposed to. So for us as a school and community, it's very positive. We can only applaud you on this program and tell you that this is really changing our community as well as our society.
In the afternoons, we did data capturing and completed referral letters of identified patients who needed further attention from local healthcare professionals. At the end of each rewarding and hard-working day, we also had the opportunity to share our personal and professional experiences. Towards the end of the week, we had to develop a digital story on how we experienced the wealth of opportunities that this program has provided us in developing our competencies.
We arrived as a group of individuals, then learned to work together as a team, but at the end of the week we experienced firsthand the true value of community.
On leaving Tromsburg and Springfontein, we had a thorough understanding of the challenges that healthcare professionals in rural communities are faced with. A reality that was previously unknown to us, coming from a traditional campus-based education and training background. It also seemed that the local healthcare professionals appreciated our limited but heartfelt contributions.
They help us with identifying problems and bringing them to our attention, bringing them to the clinic, bringing them to the community healthcare workers to say, here's a patient that needs help. And we step in and we try our best. I think it can be expanded, the program, because the need is so big. But what they've achieved in the past year and a half here in Tromsburg is amazing. And I think the positive attitude that they bring to us and add to us as a community is extraordinary.
We're also gaining a lot as community health workers, especially on the physiotherapists. we really gain a lot, so that we can also learn how they teach our patient, especially when they comes to exercises, and then we see so that we can continually helping our patient.
The Unite to Heal program is truly transforming the training of future healthcare professionals in the Faculty of Health Sciences at the university. We as students are benefiting immensely from our participation in the program.
Tromsburg, for me, as a group we went, was amazing. The experience was so nice. It was a learning adventure. We went as an IPE group. It's a newly stated concept the varsity introduced. For me, it was always very nice to see what everyone's role was, and for me as a physiotherapist, I always wondered, what does the occupational therapist really do? What does the dietitian really do? And for me to work together with them to see each part and everyone's role was amazing. And now I actually know I can refer as a physiotherapist, I as a physio can refer to the dietitian and to the occupational therapist, and that was really insightful.
I've heard about rural areas having challenges with regards to healthcare before. I've never experienced it. So when I got there and I saw what the state was, it was a shock coming from a big city and seeing the infrastructure and also the human resources available to all of the patients. What I liked about it was that you get to have a personal relationship with your patients. We saw that in home visits, and how it really brought, our treatment was really applicable to a patient because we could see their circumstances firsthand and not get it from them, their interpretation of their environment.
In collaboration with the community, several other associated community-based education activities also occurred during the year. In addition, exciting times lie ahead for the Faculty of Health Sciences as the platform is being expanded. This includes a mobile clinic visiting farms, plans to develop an integrated rural curriculum from first-year level across all the schools in the faculty, more community projects to be developed, and exploring the research potential of this rural training platform. In conclusion, the Faculty of Health Sciences at the University of the Free State and its students are inspired by the unwavering dedication of rural healthcare professionals. We are likewise committed to assist in delivering the highest level of care to communities in resource-challenged areas. Kopanang le fodise, unite to heal.